Hello, my name is Lerinette Ekwe. I'm going to be doing a presentation on the nursing shortage in the emergency department. That is where I did my clinical site assessment. So that's what we'll be focusing on. As we all know that the nursing shortage is a global problem. It's a current trending issue, especially the fact that it's been magnified by the COVID-19 pandemic. It was already an issue prior to this time, but the COVID pandemic has made the situation worse. And I feel that a lot of us have felt that impact in whatever area we are, what the nursing or outside of nursing profession, everyone is feeling that impact, be it a patient or a nurse. The article by Whittington et al. Revealed that we would need about 12.9 million more nurses by 2035. The profession is demanding, it increases stress, it's caused a lot of burnout, it's causing a lot of nurses to constantly change jobs or move to different professions. Here's a problem statement. With the shortage in nursing, it leads to increased workload. It leads to nurses who change their jobs because they're not being recognized. They're not growing like they feel they should grow in that profession. They're not given opportunities to move up the ladder within the organization. This in turn tampers with their job satisfaction, and they want to change jobs or move to different organizations and just keep the cycle of the shortage ongoing and nonstop. A lot of nurses who come into the nursing profession have many reasons for which they come in. Some come in for the morning, some come in for job securities. A lot of these people don't get proper orientation for the demands of this profession and the challenges that they might encounter and ways that they can use to address these problems. Here is a PICOT question. Within this PICOT question, we're addressing the difference between increasing the staffing rates within the emergency department versus not increasing it. What difference will it make on nursing practice, and what difference will it make with patient care? The purpose of this project is to identify the factors that are contributing to nursing shortage, implications to both nurses and patients, and how this shortage is affecting the healthcare system itself. And also I propose some recommendations that can be used to mitigate the nursing shortage. So in the emergency department where I did my clinical site assessment, I will make comments on the overall environment, facilitators and barriers. Beginning with the overall environment, this environment in the emergency department does foster, they do value cultural diversity, they encourage and they recognize, they uphold the dignity of employees and their patients. There's mutual respect among employees. There's respect when we have to deal with patient care. We know that they're there because they're sick. But again, we have to give them the respect and we have to uphold their dignity. Also, teamwork is encouraged within this environment. Sometimes you might not feel like you're being helped, but it is being encouraged because it's something I've witnessed. Also, facilitators, evidence-based practices being encouraged, the resources that are being put out for nurses to access based on the evidence-based research, which directors, managers have access, and they bring this to our notice and encourage us to use it. Also, the company is constantly organizing continuing education classes for nurses to keep up with their skills, to update skills and be up to date with their requirements or that they need to perform their job efficiently. And also they use the employee recognition program, though it's not being used frequently, but it tends to be a little bit encouraging when you know that you get a little bit of incentives here and there. It encourages you and makes you probably want to pick up some extra time of work out to help the organization out. But some of the barriers which I encountered during this assessment was that the emergency department do not have sufficient emergency equipment. For example, we do not have like a neurologist maybe at night on night shift we have to do a virtual consult. What happens if you have more than one stroke patient in the unit and the neurologist has to consult with them? You only have one equipment to use. How would you handle that? Also, didn't have access to some other confidential reports, which might be helpful, which might have been helpful for that assessment. I wasn't given access, only a limited amount of resources was provided to me. And also some of the limitations of the assessment was that we were only allowed to speak with the manager's top administrative people. We didn't have the opportunity to interview the nurses to get their opinions on what they feel like is the situation with staffing within the department. And here is search strategy, which I employed for this project, went through the NSU library and used these different search engines. During my assessment and during my review, I came up with these following themes, which I'm going to be analyzing in the upcoming slides. This is just a list of them. So I'm going to move on and start talking on this. On these themes. The very first one was factors contributing to the nursing shortage. A lot of researchers, as you see, Chen and et al., or El Jadali et al. Came up with nurse burnout, job dissatisfaction, inadequate staffing were all factors that were contributing to the nursing shortage. Again, work-life imbalance. Nurses don't have time to spend with their family. I have children, I have husband. Imagine working this 12 hours, stressed out, overwhelming shift. You get home, you don't feel like you want to be bothered by anyone. You just want to be left alone. Your children need your attention. Your husband needs your attention, but you're so exhausted that you don't want to be bothered. You just want to lay down. How do you manage this? Again, nurses tend to leave their jobs because they've been not being treated well by other employees, by their peers. The environment is not encouraging. The environment is not supportive. How do you want to work in an environment like that? Again, the high nurse-patient ratio just pushes nurses to want to move to different professions, to want to change to different organizations. That intends to leave builds up. The turnover rate increases, retention rate decreases, and the cycle just continues. Others researchers, Marisoba et al., shortage of clinical faculties and nursing program attrition. Nurses are not being recruited for various reasons. The requirements is pushing a lot of people back. We don't have enough teachers, faculty members to teach these new nurses who are coming. The stress is just too much. Why would you want to come in a profession like this after going through all the stressful nursing programs that we go through, and then you come into the profession and still go through similar situations? Do you want to keep on doing this for the rest of your life? Again, nurses tend to leave their job because they feel like they're not being recognized. Their skills are not being recognized. They're not being rewarded for the hard work. I've traveled for the past year and I've been with staff nurses of those different hospitals. We hear them complain, oh, travel nurses get compensated more than us for the same job that we do. How would you feel to find yourself in a position like that, where you feel like you're not being compensated like you should, but someone else from another company or travel nurse will come in and make more than you make for the same work that you all do? How would you feel about that? Do you want to continue working for the same organization like that when you feel like you're not being recognized for the work you do? The next theme was the impact of the nurse staffing level on patient outcome. We all know when you have a 1-to-5 ratio in the emergency department, high acuity patient, are you able to provide competent care to patient? The answer is no. You just juggling between tasks. You just trying to complete your task just to make sure that you get them done. At that moment, there's no compassion in the care that you're providing. There's no quality in the care that you're providing. Patient falls increase because there are not enough staff. Poor documentation practices. Failure to rescue. because you missed a care for a patient. Just imagine having cardiac patient, respiratory patient, end-stage renal disease, cancer patient. You all have that to yourself. How do you care for these patients who are so demanding? They're sick. They need your attention. What quality of care do you feel you're providing to them in a situation like that? Not a good one. All of these researchers, Chen et al., they identify the consequences of occupational stress on nurses, job dissatisfaction, physical, emotional, psychological exhaustion. These are the things that we nurses experience from this burnout, from this high work volume, from this inadequate staffing. People tend to call out a lot. Absenteeism, just because they're exhausted. And sometimes you kind of feel like, oh, it's a Monday, it's a Tuesday. These are usually days that are busy. Well, I'm just going to pick up my phone and say, oh, I don't feel like coming to work today because I'm sick. Then we run short. Not one, not two nurses. And then we're stuck with the volume. What do you do in a situation like this? How do we want to encourage our nurses to come back, to keep coming back? These issues will need to be addressed. Then when nurses are exhausted, they don't act right towards their patients. The patients can feel it when they're not properly cared for. Is this something that we want to continue doing as nurses? This is a profession of dignity. So people have to feel it, people have to see it through the care that we provide to them and to the community. It says we have to use critical thinking skills. You have the knowledge, but how do you apply that when you're busy? Or how do you feel like you're applying it efficiently? Let me put it that way. When you're just struggling to complete a task, when do you have time to actually reflect on the care that you provide to patients? It's impossible. Nurses tend to be burned out. Nurses tend to change their jobs because they feel like they're not accomplishing in their profession. If you don't provide quality care, you know there's something in you, know that you should have done something differently for this patient to be able to make their outcome better. But because you're not able to do it, you feel like, oh, I did not accomplish my task for today. I did not accomplish my job. And then you build up these thoughts within you, like, I don't think this is a profession for me. If I'm not able to work to my full potential, then I don't feel like this is something I should continue doing. The intent to leave builds, and then all of a sudden you switch profession. Also, nurses who do not receive recognition for the skills and their hard work feel undervalued and unappreciated, and they tend to leave the jobs. Who wants to work in an organization where they're not valued, where they're not being recognized for their hard work? Not me. Not me. I'm definitely going to switch. I'm telling you, I've worked as a travel nurse for the past year, and I do not think I want to be a staff nurse anymore. I don't think I want to be a staff nurse because the struggle is real. The burnout is real. But is this something that I love doing? Yes. But do I want to continue staying under stress for the rest of my life? No. So we definitely need to address the nursing shortage issue. And also, Wu et al. Found out that burnout is high among critical care nurses. I I'm a nurse who works in the ED. That's a critical care environment. I can speak for that. The burnout there is real. It's a fast-paced environment, and you having 4 to 5 sick patients, high acuity patient can be overwhelming, can be stressful, can be exhaustive. And the healthcare profession itself, as a whole, the burnout rate is high. That's what it's all about. Stress is real. Just taking care of people who are sick is no joke. Other professions may not see this, but we are at the forefront of caring for people at their most vulnerable moments. Also, it's high in areas where workforce distribution is not equal. Yes, nurses burn out. Yes, they're emotionally exhausted. Yes, they're depersonalized. But do we want to keep on doing this? Do we want to keep on functioning in an environment like this that is not healthy for us, for our family, for the community? So I also came up with interventions to help mitigate the nursing shortage. I came up with the acronym REACT. We got to recruit immigrant nurses. We have to educate and mentor our new nurses and let them know the demands of the profession. That way they can be able to address challenges that they encounter. And also adjust protocol to meet the needs of our nurses. Our voice needs to be heard. We have to transform our nursing workplace culture to encourage nurses to stay within the profession. Here are some recommendations: proper orientation and mentoring for our nurses, simplifying recruitment strategies so that we can get nurses easily into the profession. Also, finance the nursing program, provide support for nurses throughout their education, encourage them to use evidence-based practice, give them opinions to voice their concerns and to contribute to the change process. Thank you so much. I hope you did enjoy the presentation. I'm looking forward to change the nursing world. I'm looking forward to bring in qualified nurses into the nursing profession who are compassionate about what they do and who have a heart to serve the world. Thank you so much.